Hello, this is Dr. Scott McLean. In this video, we'll be talking about the Nobel Parallel CC conical connection implant and how I use it as my bridge implant. The Parallel CC implant has a unique body form and thread pattern that make it great in cortical bone, also thin bone. It has this tip that end cuts, so it's great for bicortical stabilization. So it's a great performance implant. It also comes in 4 different widths, so 3.75, 4.3, 5, and 5.5 millimeters. And what you'll notice is on the top of these implants that there's 3 platforms. So there's narrow platform, regular platform, and wide platform. And what you'll further notice is the 5 millimeter wide implant has a regular platform connection. If we look at the connection, it is a conical connection, so therefore it's going to allow things to be sitting in the implant 2 different ways. The 2 different ways that components can be connected to this implant are the engaging abutment and the non-engaging abutment. The engaging abutment is a conical connection type of abutment which has a hex on the bottom, a conical connection which kind of fits down inside like 2 styrofoam cups fitting together, and then it has this kind of post and core like fit, so it has an anti-rotational type of fit, which when it fits inside it's in one position. The second abutment type is the non-engaging abutment, which is usually a screw-retained bridge option in which one is connected to another one. Therefore, it's considered rotational because it doesn't engage into the hex. However, it is anti-rotational because it's connected to another implant in another location. So the other component to this abutment is that it does have the hex removed, and also the conical connection is cut way back, and it just acts as an orientation guide for the bridge as it sits on top of the implant. So if you look at these 2 connections next to each other, you'll notice that they're both used on the conical connection implants, which are the Nobel Active, the Parallel CC, and the Replace CC. And so it's a very useful type of connection because it can be used in a number of different situations. What I'm going to be talking about today is how do we use it in a screw-retained situation and make it so that it's going to be very effective. So I'm going to take these 2 connections and show you some practical views of how I'm using them in the mouth. On the top you can see the engaging single type of abutment, which is a hexed conical connection that's going to fit down inside of the implant and be locked inside, and this is called the ASC abutment, which is my favorite abutment right now. It's an angulated screw channel with a titanium connector. So this is a good anti-rotational type of connection, which allows a very stable connection and doesn't allow bacteria to even fit it down around the conical connection. So the engaging abutment is used for singles. However, it can be used for screw-retained bridges if you use a multi-unit abutment, and we'll show you how to do that in a second. On the lower you can see the non-engaging bridge. This is a implant level type of bridge that needs to sit passively on a shoulder butt joint. So you can see the hex as well as the conical connection have been cut way back, and then this sits passively on top of the implants. And this is important because we don't want to have internal pressure in the implants from the screw and from things not being passively fitting, and also from not having the line of draw. So once you go inside of the implant, line of draw starts to become an issue. So on this model, the engaging abutment shows a single use where we are using the non-engaging to splint implants together to make an implant level bridge. If we look at the platform shift a little bit closer, we can see that when the abutment is engaged down inside, there's a little bit of a kind of a negative profile that occurs that allows soft tissue to kind of grow in and act as a biological gasket around this platform shift, as well as around the 45-degree bevel. So in my opinion, this is a favorable type of response, because if we have a platform match type of bridge where the profile is kind of flat down the outside, then you have a little bit less soft tissue growing around this area. And it's this soft tissue that I feel is so important to sealing off the implant against bacteria from the oral cavity. And so if we can do this, we can try to maintain as much crestal bone as possible and therefore create a nice seal. There are many clinical studies now that show that if you have 2.5 to 3 millimeters of soft tissue around the platform shift, that this can help to maintain bone in the crestal bone area. In fact, the 45-degree bevel should also do the same thing. In the Journal of Periodontology in 2010, there was a meta-analysis study that showed that platform switched implants perform better than platform matched implants by protecting the crestal bone. There are two typical screw retain options that I do with the parallel CC. First is to use the platform shift and use a multi-unit abutment, and the second is to sit down on top of the platform shift and have this covered over and then use the 45-degree bevel as my second platform shift. So I'm going to show you how to do both of these options. We'll go in reverse order and look at the implant level screw retain bridge first, which is an option I like to use often when I have limited prosthetic space. So on this particular bridge, what we're going to do is have the prosthesis sit directly on the flat platform of the implant, which is the platform shift. The great thing about this platform is it still leaves that 45-degree bevel, which is going to allow you to have more soft tissue to help to seal the implant. Now when you're doing an impression on this particular platform, you need to use a special impression coping for bridge. So it's going to be marked with a B on the side of the impression coping, and it's not going to have a hex. You'll notice that there's a number of material options that you can do: titanium, zirconia, and gold, and these will sit down on top of the implant platform. When you're doing this type of connection, the implants have to be strategically placed, plus the hex and the conical connection are going to be cut back, so we're not going to have any internal pressure inside of the implants, which is important for the implant stability because we don't want vertical intolerances. So as you screw down the screw would actually put lateral pressure on the implant, causing possible fracture. My second option is to do a multi-unit level screw retain bridge. In this screw retain bridge option, we use a multi-unit to engage down inside of the conical connection, which brings it more up to just below tissue level, and then this flat platform can be picked up using multi-unit impression copings. So now the passive fit is going to be on top of the multi-unit instead of on top of the implant. Now the beauty of this is that you maintain the soft tissues by sealing them off. So once this multi-unit is placed, you're never going back down to implant level at the time of bridge impressions. So this seals it off so that we can keep infection and also bone loss and crestal bone very happy. So if you're doing a all-in-4 procedure, we can also use angled abutments, which are engaging with a hex, and they come in 17-degree abutments and also 30-degree, so you can line the platforms back up so you'll have passive fit of your bridge when you're doing your final restorative phases. And this is important because we've maintained the platform shift in yellow. We also have a 45-degree bevel, but now we have this at a higher level. We do not want to place these too high. We want to have these at a level just below the tissue so that we can kind of seal the bridges off using restorative techniques. So the parallel CC implant is fantastic for all-in-4 procedures. It's got the smaller thread, which sometimes needed in thinner bone. It has the tip that's going to engage in the cortical plate, so you have bicortical stabilization. You can tip it. It also has the conical connection with that 45-degree platform shift. And last, the thread is at the very top of the implant, which I like. The thread being up top is going to enable you to have soft tissue seal. If you lose a little bit of bone over time, the implant's going to slip down to that first thread with the bone, and then the soft tissue is going to seal around there. So when I'm doing screw retain bridges, I like this particular implant. It's got the ability to have a platform shift around single abutments, but also multi-unit abutments. Or you can go to the top of the implant as shown here, and both will still enable you to have another platform shift on the outside of it due to the 45-degree bevel. And then the thread sitting up top is going to make it even kind of a security marker for where the soft tissue is going to heal. One of the neat features of the surgical kit for the Nobel parallel implant is that it also works for the Noble Active, which is also a very effective bridge implant when you're using the multi-unit abutment. Looking at an actual case, you can see I did smart fusion on the upper arch and then guided surgery on the lower. You can see the smart fusion. I was able to place these implants, get them in same time, same day as extraction, and look at 3 months later, how well the bone's doing. It's staying at the top of the implant, around these implants. There's the multi-unit and the cylinder sitting down. So this is just fantastic, and this is what you want to see around an implant system. You want good soft tissues, and using bridges to maintain these and kind of shaping them. There's definite patterns to how you can create this, and I do offer courses on how to plan and then how to implement and how to create long-term success with soft tissues. So check with your Nobel Biocare rep. Last, don't forget to subscribe to my YouTube channel so you can get free updates on new videos. So this is Dr. Scott McLean, and this has been a YouTube presentation about implant dentistry.